Hi, welcome to Pinnacle Hand Therapy. Today we're going to go inside and we're going to talk about physical agent modalities, also known as PAMs. So what we have here is the ultrasound ESTIM commercial panel that I want to talk about. Here is the ultrasound in the head. So this button right here would actually activate that. You see that you get the U channel here. It is a default for 5 minutes, right? And I'm not going to demonstrate IFC. IFC is interferential current. In order for me to actually demonstrate that, it would require me to use another set of leads. I would actually place one on, we have now on the extensor side, I'd place one parallel on the flexors at the forearm and the arm. And essentially what an interferential current would do for us is to allow the ESTIM to kind of fluctuate between, sweep between these 4 electrodes. So I'm going to stop that one and I'm going to go back to my main menu, pick up number 2, and then we're going to talk about pre-mod. So interferential and pre-mod are both used for pain management. The other option that we use for electrical stimulation for pain would be the TENS unit that for some people are their home units. But if we were to use pre-modulation, again, the goal is to place the electrodes above and below the area of pain. We press the button, and in most cases we are going to leave it at its preset. Again, you're going to ask your patient to let you know when they first feel the sensation of the ESTIM. It's typically like a crawling type of or tapping sensation, and I always tell patients that if it feels like it's grabbing you, you usually want to go back. So we're going to go up on our patient and let him tell us when he starts to feel it, okay, and he can feel it there. So at that point we would just push start. High volt is typically used in conjunction with the combination of ultrasound and ESTIM, but high volt by itself is designed to work on swelling and healing. So again, typically I like to make the high volt channel either follow a pattern of swelling, and in some cases I will actually change so that we have one on the dorsal and then one on the volar aspect in order to introduce high volt. But high volt is for healing and for swelling. Russian is actually also known as neuromuscular electrical stimulation, or EMS. So let's actually take a quick look at that. So I'm going to use channel 2, and we're going to do Russian. And Russian is really interesting. This is one of the ones that you're going to use when you want to have an extremity or body part pull through typically scar tissue, or if you're trying to elicit motion that the patient can't elicit independently. So one of the things that we're going to do here is we have a resting and a working phase. So we're going to do it for 10 seconds on and 10 seconds off. So I'm going to ask the patient to bear with us. This time we actually want to see the muscle contract on the Russian. So tell me when you feel it. So you can see that there's motion, but I got to go high. So what you're going to see is there's the twitching, if you notice it here, and it's actually causing, okay, now we're going to push start and it'll go away. But what will happen for 10 seconds, notice this number here, it's holding the position, and then you'll see it relax after 10 seconds. The muscle's moving, we're getting a good pull through, and now the relaxation as it goes down, okay? We'll do it once more, but we'll stop there, not to torture, okay? All right, so watch for it to crank up, the muscles are working, and we're getting a good muscle interaction. All right, and then watch what the number does. It goes down. All right, and we'll stop with that. Okay, so that is the electrical stimulation. And one of the things that's very important for me to say is that you have to follow your state rules with regard to who you can actually administer physical agent modalities.